Hi, I'm Dr. Ivor Benjamin, conference co-chair of the AHA-ACC Consensus Conference on Professionalism and Ethics, a consensus conference report.
I'm a past president of the American Heart Association. I'm also the director of the Cardiovascular Center at the Medical College of Wisconsin.
I'm joined today by Dr. Emelia Benjamin, who was a lead author of this paper and specific task force on diversity, equity, inclusion, and belonging. Dr. Benjamin is professor of medicine and epidemiology at Boston University Schools of Medicine and Public Health. I want to talk about the long-term action items that have been developed by your task force.
So the first thing is everything in the academy that's valued is measured. How many patients you see, RVUs, it's measured. How many grants you have is measured. How many papers you write is measured. We know from the business and the quality literature that if you care about something, you have to measure it. So we as leaders and as institutions have got to double down on our commitment to assessing diversity metrics. We need to be conducting robust qualitative climate surveys that are across domains, in the educational space, in the clinical space, in the research space, so that we can understand current state, we can come up with plans to address it, we can enact it, we can study it, and then start the PDSA cycle all over again. Because we have to be able to figure out what the lesions are, embrace best practices. How do we have team membership? Do we have citizenship? Do we have cultures of mutual respect? Do we have effective allyship? Do we have anti-racist, anti-sexist institutions? How can we support and promote others? So qualitative data has got to be a piece of this. Quantitative data has to be a piece of this, quantitative metrics. I talk to chairs of medicine and I ask them, by the way, when you have done an analysis of metrics, compensation, mentorship, sponsorship, resource allocations, startup packages, space, promotions, compensation, is it equitable? Virtually every chair of medicine I've ever spoken with says that they have to do the analysis and every single year they discover inequities that have to be addressed. So we've got to have quantitative metrics that measure the things that are necessary for people to be successful.